Good morning, all, and welcome to the National Medical Association's Saturday webinar, COVID-19, the impact of social determinants, disparities, and climate on healthy living. This is the fourth in a series of Saturday webinars presented by the NMA. The first COVID-19, an update, March 28th. The second, COVID-19 and vaping, on April 11th. The third, COVID-19 and HIV, last Saturday.
Okay.
Would all that are on this please mute your microphone? The National Medical Association is accredited by the American Council for Continuing Medical Education, ACCME, to provide continuing medical education for physicians. The NMA designates this live activity for a maximum of 1.5 hours of AMA PRA Category 1 credits. Physicians should claim only the credit commensurate with the extent of their participation in the activity. Only registered webinar participants are eligible to earn CME hours. Facebook Live participants cannot claim credit hours. To claim credit, learners must complete the post-activity follow-up evaluation, which will be sent to the email address you provided at registration. Would all panelists please mute your microphones?
I think it's a participating caller. All callers need to also mute.
Thank you. The NMA is the leading voice addressing the concerns of our nation's 50,000 African American physicians and the health and wellness of the African American community. Webinars such as these are part of our efforts to keep ourselves informed regarding issues relevant to us, especially in a time of crisis such as this. Do note, however, that the NMA has been sounding the alarm regarding health inequity long before COVID-19, for decades, in fact, and will continue to do such after this crisis period has passed. The state and local societies have been active. The Georgia State Medical Association submitted a release with the position of closing the reopening of Georgia, not in concurrence with the lifting of restrictions. Other states and local societies have taken similar action. The NMA is speaking up where our voices need to be heard. Now, reflecting on today's webinar, talking about social determinants, disparities, and climate on healthy living. Broadly, there are 6 categories of social determinants of health that include economic stability, social and community context, education, healthcare, food, and neighborhood and environment. And we will touch on some of these today. These are all touchstones that directly affect outcomes. These are the external factors that affect our internal biologic processes that lead to wellness or disease. Today, we have assembled an expert panel to address the issues of disparities related to social determinants and climate change on healthy living. And I have the pleasure to introduce to you the moderator for today's discussion, Dr. Doris Brown. Dr. Brown received her BS from Tougaloo College in Mississippi, an MPH from the UCLA, the University of California, Los Angeles, and her MD degree from Georgetown. She completed her internship, residency, and fellowship at Walter Reed Army Medical Center in Hematology Oncology in Washington, D.C. Dr. Brown is president and CEO of Brown & Associates, LLC, a health consulting company that manages programs addressing national and global health disparities. She is the 118th president of the NMA, and as such, her program theme focused on a collaborative approach to health equity entitled The Urgency of Now, Creating a Culture of Health Equity. She retired as a colonel from the U.S. Army Medical Corps, where she was the director for medical research and development at the U.S. Army Medical Research and Material Command. She also retired from the NIH, National Institutes of Health, National Cancer Institute, where she managed the breast cancer portfolio in the Division of Cancer Prevention. She tirelessly champions many causes that have significantly contributed to improving the health status of vulnerable populations. She has achieved both national and international recognition as an expert educator and speaker. She has been featured or quoted in many news articles and op-eds, including the Army Times, U.S. Medicine, Ebony, Essence, Washington Post, PBS NewsHour, and ePolitico. There's much more to her extensive bio. I will just note by saying that she has demonstrated great leadership and advocacy in the areas of social determinants of health and climate change that are the subjects of today's presentation. I present to you our distinguished moderator who will lead the discussion today, Dr. Doris Brown. Dr. Brown.
Thank you.
You may be muted.
Thank you, Dr. Brooks. And I want to say good morning to those on the West Coast and good afternoon for those on the East Coast. Today, I think it is very important that we speak to you about the social determinants of health. And Dr. Brooks has mentioned the broader categories, 6 that pertains to the social determinants of health. But we also have to consider within those 6, the systemic disparities that we have within our healthcare system, the burden of chronic diseases that these individuals come forth, and why we are seeing such disparities in the COVID-19 pandemic. We know that opportunity and inequity is inextricably linked, and we must keep that in mind as we move forward to look at the consequences of what is happening with COVID-19 and our population. And if we look at just a little bit of the data, 30% of African Americans have succumbed to the COVID-19 pandemic. And yet we are only 13% of the population. So those numbers continue to grow in various cities around the country. And I'm sure you've heard that over the news. And so while we will not focus on that, we want to talk about some of the consequences of things that you may not have heard before and how we can go about bringing about changes, because we recognize that there are a lack of resources in terms of food and water and shelter and transportation. In addition, we are seeing the stresses that this disease, as well as social distances, has caused in terms of the impact on our patient population. And you're getting individuals that are protesting in the streets because they want to go back. Again, may not be the best decision, but those stresses are leading to an increase perhaps in domestic violence and abuse. We have the worrying about the potential loss of our income. And we know that within this disease, again, the aging, the vulnerable populations are at greater risk for having a higher mortality. And that also includes our environmental situation of where we're going. And I should say, it may be one of the only good factors that's coming out of COVID-19 is we've seen a decrease in the smog in some of our larger cities and a clearing of some of our waterways because we have maintained the social distances and being shut down. And so today we're going to hear from an illustrious panel that's going to cover some of these areas. Our first presenter is Dr. Catherine Alicia Georges. I want to say I know Dr. Georges by Alicia. And so if I slip and say Alicia, know that I'm making reference to Dr. Catherine Alicia Georges. She is serving as the AARP National Volunteer President. She took on this role in 2018, and of course her term will end in 2020. And as the volunteer president, she also serves as a member of the AARP Board of Directors. The principal volunteer spokesperson and liaison between the board and the AARP membership is done by the volunteer president. Dr. Georges is also a professor and chair of the Department of Nursing at Lehman College and the Graduate Center of the City University of New York. She is also president of the National Black Nurses Foundation. Her training comes at Seton Hall University College in Nursing, as well as the New York University and the University of Vermont. And again, I present to you Dr. Georges.
Good morning and good afternoon. I thank you so much, Dr. Brooks and Dr. Brown. The coronavirus pandemic has brought our country face to face with a hard truth. That is the gaping health disparities that exist across ethnic, racial, socioeconomic, and geographical lines in the United States, often in defiance of more promising trends that affect the population as a whole. For those of us in the African American community, that's not breaking news. But it must be said again and again, so that both in the ways the government addresses COVID-19 now and in how we shape healthcare policies going forward, including preventative healthcare, we must confront and close this terrible gap in health outcomes. As Dr. Brown said, in the US, COVID-19 has taken an especially heavy toll on the African American community. African Americans have been hospitalized and are dying at disproportionately high rates, particularly here in New York. These disparities are not random. They are the product of a long history of inequality that comes from a lack of social, economic, and political opportunities. Today, direct workers who are primarily women, people of color, and immigrants are on the front line of the coronavirus pandemic, which then puts them at a greater risk of being exposed to COVID-19. For the most part, these folks receive low pay, they don't have paid leave, and they can't afford a disruption in their paychecks. Therefore, they are forced to make an awful choice every day, whether to go to work and risk getting infected and potentially infecting others, or staying home and facing a financial crisis. But let's take a step back from this crisis just for a minute and look at some of the factors driving health disparities. And you heard some of them from Dr. Brooks and Dr. Brown. Poverty is a strong indicator of poor general health. Poor people are more likely to have worse diets, greater risk of diabetes, obesity, and heart disease, and they get less care for their chronic diseases. We know that all of those factors are risk of dying when you get infected with a coronavirus. Over a third of Americans either delay or don't get their prescription that is filled. They skip a dose, or they take less medicine than the physician has prescribed to make it last longer because they don't have the money and the prescription drug costs are so high. At AARP, our members are 50 plus, but rest assured our perspective is broader. When we say that AARP's purpose is to empower people to choose how they want to live as they age, we're not just talking about people over 50. By the time people of color reach older age, a lifetime of limited choices, lack of opportunity, and discrimination has caught up with us. Aging well is a lifelong pursuit that begins the day we are born and ends the day we die. The external environment we face and the behaviors and the habits we develop when we're young have a direct impact on the quality and the length of our lives as we get older. We used to say that the secret to a long, healthy life was to choose your parents well, but today we know better. Only about 20% of health status is due to genetics, and about 20% relates to what kind of medical care received. The other 60% is due to the external factors and the choices we make throughout our lives. As we pay greater attention to social determinants of health, things such as poverty, food, insecurity, clean air and water, housing, transportation, smoking, substance abuse, and abuse. These have profound impact on health outcomes. We also need to make sure social isolation is identified as one of those social determinants. Last summer, I testified before the National Academy of Medicine. At that time, I urged them to specifically recognize and recommend to policymakers that social isolation be addressed as a social determinant. Little did I know that we would all be isolated in 2020. These social determinants put African Americans at a greater risk of COVID-19. If there's one thing I would like to come from this pandemic, it would be that we take advantage of the opportunity we now have to build a more equitable society. All people should have access to the resources, services, support, and a healthy environment that empower them to live a life of dignity, a life of good health, and a life of purpose, regardless of age or race or zip code or income. Building that more equitable society means intense and sustained attention to the social determinants of health that generate such stark disparities. We also need to do whatever we can now when we are stuck at home and after this difficult period ends to take control of our own health. I'll start with social isolation. You've heard of the study that says prolonged social isolation is as harmful as if we smoke 15 cigarettes a day. But among social isolation these days is a serious challenge, particularly for those who do not have the technology for virtual connection. For those of us with access to that technology, it's important to use it. We have got to stay connected to our families and friends. Research shows that the more friends you have, the more healthy behaviors that we have, peace of mind, volunteering, taking on new challenges. Social connections are a key to healthy living. So is another behavior that may take some adaptation at this time. That's exercise. We're not gonna have any NBA, maybe no NFL, baseball, whatever to watch. So we've got to exercise our own muscles. So in doing that, please go to AARP, www.aarp.org. You can find exercises that you can do at home in 10 minutes. This is especially important now when so many people are abandoning normal exercise routines and risking a loss of physical strength. I just want to share real quickly an interview that was done by Dr. Tan, who is one of our geriatricians and a director at AARP Thought Leadership. And it was with a Dr. Julie Silver from Harvard. And Dr. Silver notes that by staying at home, we decrease our physical activities, and it can lead to a cascade of events in the body that may make us more susceptible to infections and less likely to fully recover from them, especially older adults and people with underlying health conditions. Those are the most who are at risk for severe illness. Dr. Silva says what a lot of people do not realize is how quickly we lose strength when we decrease our daily physical activity. Older individuals are more likely to lose the muscle mass at a faster rate than younger people. So if we lose that, then there are all kinds of things that happen to our hearts and lungs. The good news is that doing some exercise before we get ill has a protective effect. I want to conclude by making a few points about caregiving and about the situation in our nursing homes in this country. There are challenges in caregiving that have gotten even more intense for us and complicated in this time of COVID-19. We know that caregivers are pulled apart so often. There are so many people now caring for an elderly parent, and now they're having to take care of their kids at home while schools are shut down. Yes, family caregiving may be a great expression of love and togetherness, but folks, caregivers can often feel very much alone, overwhelmed, and underprepared for what they have to do. They deal with physical, emotional, and physical stress and financial stress. And they demand our respect and deserve our respect. So it's vital for you, if you're a caregiver, to take time to take care of yourself. That means trying to find a time to unwind. Talk to your friends. Taking a hot shower or bath helps. You also need to reach out to others for help. And then the stress may come quickly now because of finances. And we found in AARP that the caregiving expenses of African American caregivers represents on average 34% of their income, and they're strapped right now. So we support a tax credit of up to $3,000 a year for caregivers. I want you to encourage you to go to www.aarp.org/caregiving. We have plenty of resources available for you. Finally, let me turn to nursing homes, where we now have a horrible crisis within this crisis. Over 10,000 seniors in nursing homes have already died from COVID-19. AARP is urging the federal and state governments to protect our seniors in nursing homes. We are also suggesting important questions that people must ask at this time if they have a loved one in a nursing home. The questions are up for you to see, but has anyone at the facility tested positive? And we want you to be sure that this includes staff members, the residents, and any vendors who service the facility. How is the staff cleaning the facility and keeping the risk of infection low for residents? Are regular healthy living programs being maintained? Dr. Charlotte Yett, our Chief Medical Officer, suggests find out if they're continuing the services such as physical therapy and OT programs that are meant to keep your loved one from deconditioning. Are they engaging residents? What kind of entertainment or enrichment are they providing? How can you communicate with your loved one? Some of the facilities are using technology, but you need to reach out to them so that you can connect with your family member. And how is the facility handling drop-off delivery? AARP has many resources to help you at this difficult time. You will find them at aarp.org coronavirus, and check out our resources. They're here under www.aarp.org coronaviruses. Remember that AARP is here to help, and we will do everything to assure that our members and America stay safe and healthy. Thank you, Dr. Brown.
Thank you, Dr. Georges. I do want to just point out a couple of factors that I've forgotten. We are taking questions. Would you please write your questions in the question box, and then at the end of all of the presentations, we will then direct those questions and answer them for you. As you've just heard, the social determinants of health happens to be magnified during the COVID-19 pandemic. And so it is very important for us to address those social determinants in all aspects. And so our next presenter, Bob Blancato, is going to speak to us about the nutrition and aging. He is the president of Matz Blancato and Associates, and he serves as the national coordinator of a bipartisan committee on the Elder Justice Coalition. He is also the executive director of the National Association of Nutrition and Aging Services Programs. He has been recognized as a national advocate and policy expert, having been invited by both the Senate Finance Committee and the House Ways and Means Committee to testify on a range of issues. And Bob's prior history also includes many years as a staffer in Congress, and he was appointed by President Clinton to be the executive director of the 1995 White House Conference on Aging. In the meantime, as part of his volunteer services as of the National Board of AARP and the National Hispanic Council on Aging, he also serves as the National Advisory Committee on Rural Health and Human Services, having been appointed by Secretary Azar of HHS. His education includes Georgetown University and American University. Welcome, Bob, and we look forward to your presentation.
Thank you, Dr. Brown. Appreciate the nice introduction, and also Dr. Brooks, thank you as well for today. And I am honored to again participate in an NMA event, and especially one that is as timely and important as this one. I'm also especially honored to follow my friend and close colleague, Dr. Alicia Georges, who does great volunteer leader for our AARP. We are entering the second 100 days of this pandemic. It is testing us as a nation every day, but it is also showing the compassionate and caring side of the people of this great nation. We do note, with increasing concern has been brought up by both Dr. Brown and Dr. Georges, that social determinants and health disparities are real factors in the pandemic in terms of its victims. Consider here in the District of Columbia, our mayor said that 85% of coronavirus fatalities were for persons with underlying health conditions, with hypertension and diabetes the most cited. About 80% of Georgians hospitalized with COVID have been African American, about 40% had diabetes, and a quarter had cardiovascular disease. And this morning a poll was released by Morning Consult that said that more than 1 in 10 Americans said that they may not be able to pay for food if the social distancing continues for another month. Social determinants of health are getting more attention in Washington than ever before, and even before COVID-19. I recall a speech delivered last year by Secretary Azar, who noted that the root cause of so much of our health care spending is tied to social determinants of health. He went on to say we need to do a better job at aligning federal health investments with our investments in non-healthcare needs. He gave an example of an ACO model where high utilizers of healthcare services are screened for social determinants such as food insecurity. I note also this year that the Centers for Medicare and Medicaid Services released a report on the use of codes that are used to report Medicare beneficiaries' social determinants of health. While that's a very good step, a lot more needs to be done, since the report only identified 1.4% of the 33 million Medicare beneficiaries having claims with social determinants. We know the figure is much higher. It's also important that the information from these codes needs to be transferred into standardized data for greater use. And last year there was bipartisan legislation introduced on social determinants of health, which would award up to $25 million in grants for the development of social determinants of health programs within Medicaid programs. And we are hopeful that this bill can pass this year. I am here to address the issue of nutrition from the vantage point of being a social determinant, but also a key factor in healthy living. Often cited as social determinants in the nutrition space are hunger, food insecurity, access to healthy food options, and of course, malnutrition as it relates to older adults. Our bipartisan, over 100-member Defeat Malnutrition Today coalition was created in response to the growing incidences of malnutrition in older adults, and in recognition that malnutrition is a vital sign of older adult health risk. More specifically, 1 in 2 older adults are at risk, as cited in our national blueprint. Malnutrition leads to a 300% increase in healthcare costs, longer hospital stays, and using conservative figures, HHS cites $42 billion in healthcare spending each year related to malnutrition, since those with malnutrition are twice as costly to treat at a hospital as those who come in well nourished. Older adults of color are more likely to have chronic health concerns related to nutrition. CDC says African Americans are 40% more likely than non-Hispanic whites to have high blood pressure. HHS Office of Minority Health states that the rate of diabetes diagnosis is 60% higher among African Americans than non-Hispanic whites. Food insecurity is also linked to malnutrition. Simply put, malnutrition occurs when the body does not get the nutrients it needs. The current pandemic has cast an important new light on the urgency of maintaining nutrition, especially for older adults. In our National Association of Nutrition organization, we work on behalf of 4 million older adults who get their daily meals either in congregate sites or at home, with the Older Americans Act as the main federal funding source. The pandemic has radically altered this picture. According to a survey we have in the field, 25% of respondents said that 100% of their prior congregate participants were now getting their meals at home. Congress, in response and to date, has pumped in $750 million in emergency funds just for the Older Americans Act nutrition programs to meet the higher costs for home delivered meals, including transportation and staff costs. Yet, as important as this is, we have to recognize another reality and another social determinant of health, as Alicia pointed out so eloquently: those older adults who are increasingly isolated and lonely. This is why we are working to get more funding into so-called reassurance programs, where those isolated older adults can be contacted on a daily basis using the telephone or technology. But of course, we have additional concerns about those same isolated older adults and malnutrition. The meals being provided, as important as they are, do not represent all the proper nutrition an older adult may need. So we were heartened to see and continue to see the actions of the President and CMS in greatly expanding the use of telehealth and telemedicine during this pandemic. Our Defeat Malnutrition Today coalition strongly advocates for screening for malnutrition and expanded medical nutrition therapy be allowed to be covered and reimbursed through telehealth. We are in communication with both CMS and Congress on this point. And we have our resource page up there. Let me call out two items to you. One is our COVID-19 section of our website for the Defeat Malnutrition Today coalition that you'll see. And you'll find national and state nutrition resources on there. And later this month, we will be releasing our second and updated version of our national blueprint, Achieving Quality Malnutrition Care for Older Adults. We will continue to monitor the impact of the virus on important aspects of nutrition, including supply and access. We need to change policies so that perfectly good and healthy food, especially fruits and vegetables, are not destroyed because they cannot be shipped when we know there's a big demand. We have to remove as many barriers as possible for those in our nation who need the SNAP program. And two things we need to do right away. One is to raise the minimum benefit, and the second is to allow online shopping by SNAP recipients. We need to make sure that as many direct service providers serving our older adults have proper protection and PPEs. We will continue to work for additional funding to meet emergency needs. And finally, as a nation, as this webinar title suggests, let us address social determinants, health disparities, and the climate, so our future is about healthy living. Thank you very much, Dr. Brown.
Thank you, Bob. That was really wonderful. Again, very important. And hopefully our listeners are seeing how opportunity and inequities are so devastating because they are linked. And if we get rid of and do not have opportunities, we are not going to be able to decrease the inequities that we're seeing in healthcare, the availability to get nutritious food, to exercise, and to have a climate that is healthy. So it brings us to our next presenter, Dr. Cheryl Holder, who is serving as the president of the Florida State Medical Association, and it is a state affiliate of the National Medical Association, and it works with the local societies in the state of Florida. Previously, Dr. Holder was the medical director of the Jackson Health Services North Dade Health Center, where she developed the HIV/AIDS care and treatment program as part of the Ryan White Act, and she participated in the CDC and the NIH advisory and programmatic program reviews for HIV treatment and vaccine research as part of the community-based participatory research programs. Recently, she joined the faculty at the University of Florida International Herbert Wertheim's College of Health, where she is addressing programs on diversity in the health profession through the pipeline, HIV prevention, and the health impact of climate change. Dr. Holder is the director of the Green Family Foundation Neighborhood HELP Education and Pipeline Program. She is also co-chair of the Florida Clinicians for Climate Action to increase climate literacy and awareness on the health impact of climate change on health, especially for our vulnerable populations. Her education is through Princeton University and George Washington University School of Medicine. We welcome Dr. Cheryl Holder.
Good afternoon, everyone on the East, and good morning on the West Coast. It's a pleasure to be here and to talk about climate change and COVID. I'll give a quick little summary on climate change because as we talk about social determinants of health, where you live, where you work, where you play, the policies that impact you, your access to money and power drives everything. And the biggest social determinant of health is our planet. And planet Earth is under attack with heat and all the changes that we see. If you think of the Earth, think of a thin layer of the atmosphere, almost like a fleece blanket that surrounds us. And that blanket keeps us just at the right temperature, not too hot, not too cold. Now, when you think of levels of gases going up and putting another level onto that fleece blanket, making it more like a goose layered down-filled blanket. And you know, when you put goose down on, you feel even warmer. So that blanket that used to be very thin, keeping us not too cold, not too hot, is now filled with CO2 and other greenhouse gases that is blocking the heat that we generate, that we make too much of, from escaping. And it's now being blocked by this goose blanket, which then makes us much warmer. So as we face this environmental challenge of the place that we live, we work, we play, we pray, we do everything in, we are faced with tremendous challenges that COVID is just another example, but the climate change pandemic, which is much more slow going, is showing us it's the same thing that COVID has brought to the forefront. COVID is possibly a result of what we've been seeing, because if you look to the origins of the virus, it takes us back to China in the wet markets. And what we know about climate change with the heat and the destruction of our rainfall, the increase in the arid conditions, the decrease in the growing areas, the threat to our population, and also the pushing of man to connect more with wild animals and seeking food in other places had led us to much what we see in these wet markets in China, where there's more wild animals being mixed in with man and bringing that intersection of wild species and the viruses that live in wild species being able to jump into man. So the zoonotic spread of the coronavirus has some implications to what we're seeing across our planet with the threat of the rising temperatures. We know that climate change by 2013 is going to cause over 250,000 additional premature deaths. We see in COVID what a sudden increase in a vector-borne illness can do. Slowly, with the rising temperatures and the challenges that we see, we anticipate this death. By the end of the century, we know that over 3/4 of our Earth's population is going to be faced with heat challenges, because as that temperature rises, it gets very difficult to cool our planet in the evening, and then that increases our susceptibility for more of the heat-related illnesses. How does that work with poor, vulnerable people? just as COVID has shown that the more vulnerable you are, where you're out in the environment, you're more exposed to it. It's the same way that we're finding the poorer populations are being impacted by climate change. It's the understanding of climate change over the years. We see the difficulties with accepting the science. We see how COVID is bringing that back to us, where we had difficulty understanding the science behind COVID and understanding how it's being transmitted and the acceptance of it. And even our reopening practices take us back to the limitations that we have as a society in understanding how science works, in understanding who is impacted, in understanding how we can best protect our health. When you think of climate, and I have a slide up, and this is the most important take-home message that I want everyone to understand with climate, because just that simple rise in temperature, when we talk about 2 degrees, I take us back to our bodies. When we go up 2 degrees, as we're measuring temperatures for COVID, we look for the rising temperatures. And we're talking from 98 to 100. And we're like, that's 2 degrees, that's a little signal. We know when our planet rises, temperature rises 2 degrees, we're in for significant injury. And the 4 main ways that heat and the climate impacts us is: 1, directly through extreme heat, through air pollution and extreme weather. The second way is through the spread of disease, where you have the insects and other vectors, you get contaminated water, you get contaminated food. And then another way is disruption of the food supply. And we just had a wonderful talk about malnutrition. With climate affecting our temperatures and the areas that are growing and the increase in spread of the deserts, we are going to face more malnutrition across the planet. We see in COVID some of the longest food lines that I've ever seen in Florida and across the country, across the world, where our food supply has been disrupted acutely with COVID. But that's what climate change will do overall. And we're seeing some of the wars that we're already seeing between the Syrian war. I'm in South Florida, and many of the Guatemalans that migrated here in search of better living conditions happened because the crops that they were growing in their communities in Guatemala and in Central America have been failing because there's less rainfall and there's more arid conditions. We're already seeing the migration of poorer people. And the one last thing we mentioned, and Dr. Georges mentioned, another way that climate impacts us: disruption of well-being. We know that emotional stress is a killer. And as the temperatures rise, we've seen a direct correlation with increased interpersonal violence and domestic abuse and violence across as temperatures rise. So with these issues, we see 8 really big health problems: the heat illnesses. And I consider what's going to happen in COVID during the summer. As we cannot really go outside, we know the virus is out there. How do you wear these masks in the heat? And the temperatures not getting as cool at night, so then it makes us less able to adjust to the rising temperatures, increased dehydration, increased blood pressures, increased complications just from heat illnesses. Heart and lung conditions are worsened in heat. And again, with COVID, we know that those are most vulnerable. So we're putting another factor in the vulnerability of populations, especially populations that are living in close environments, may not have air conditioning to keep cool. Where do you go for cooling? Our traditional places may end up causing crowding. Many folks would go into libraries, would go into malls, would go in places to get cool. Where do we now go? There's asthma worsening, injuries from extreme weather. We're looking at a hurricane season that could be more devastating, flooding, tornadoes. How does one, in the terms of COVID, where you cannot get crowding, how do you shelter during these situations? Water and foodborne illnesses, the W. We know the extreme rainfalls. The rainfalls are not just that more than ever, it's over the time. So in less than half an hour, the amount of rain that occurs in our environment is 3-4 times the amount that you would have, which causes increased flow. So us in South Florida, we experience a tremendous amount of rain, which then causes the sewage system back up, which then makes your waters be nutrient rich, which is more bacteria and diarrheal illnesses. One thing we know with COVID, that once it gets in your system, it gets in the feces. The virus, COVID virus, can live in the feces 30 days or more. So as we have all of these situations that happens from climate change, and you're having a nutrient-rich water supply, water that's stagnant, what does that really mean for us? There's so many unknowns. Our allergy seasons have extended because our trees are growing faster because of the increased CO2. Even though our trees and our plants grow faster, they're not as nutrient rich because the speed at which they grow cannot keep up. So they're not as strong in the wheat and the nutrient content, but it does increase our allergies. We get the vector-borne diseases. I shudder to think what could happen if Zika chikungunya shows up again, because with the warming climate, the range for the mosquito called Aedes aegypti, which only bites humans, bites during the daytime, extends further north from the tropical regions and moving up the Carolinas and higher. So the vector-borne diseases don't go away because we have COVID. So now that we are now trapped, if our homes do not have screens, we do not have an air conditioning cooling system, and we get exposed to these mosquitoes, what will happen? There are even more, there's Lyme disease, there's Western equine, Western Nile diseases. They're all spread by all these vectors that are moving north as the climate warms. It's not just a tropical problem, but it's all across America. California itself has the West Nile virus that will continue to expand across the climate. So as we look at the vector-borne diseases, those are issues we have to contend with as we deal with COVID, and how do we control COVID? Again, we get to the emotional stresses that we've discussed, all the social isolation, just the stress of dealing with the heat, the stress of sheltering, the stress of extreme weather, worsening of your lung conditions, and knowing that poor people, Black and brown people, are already facing the largest impact of climate change in America and across the world. So it gets us to one of the big issues that we saw in COVID, which was the particulate matter 2.5. You hear about that a lot, which comes from pollution. And Black folks and brown people are much higher, 43 to 46% higher, living around corridors where there's higher amount of pollution. Everyone knows about the 2.5. What that means, are about 25,000 microns in an inch. So 2.5 microns is a teeny particle that is spread in the air as we burn our fuel. So if you live near power plants, and you live near highways and in the cities, you're much more likely. We found a 1%, and was reported by the Harvard Review, a 1% increase in exposure to particulate matter increased your death from COVID. So some of the extra death that we're seeing among Black and brown people during COVID is the impact that the pollution had already had on their lungs, which then made them more susceptible to damage. As we look overall on climate and health, we have the perfect storm with COVID in that it exposed the vulnerabilities that we've been speaking about for many, many years on social determinants of health. It exposed the vulnerabilities in our society's misunderstanding of science. It exposed the need to have trusted messengers, and that's why it's great that NMA has stepped up and other organizations to be able to clearly protect and guide our communities, because you need a trusted messenger to help you decide what is best. As simple as wearing a mask or not wearing a mask became a huge debate. How do populations that are very vulnerable, who come from a history of never being treated as fairly and not getting the proper information, how do you then trust the messenger saying, oh, now wear the mask? So it brings all the areas that we as a population, as a community, has to deal with climate change, because as COVID gets controlled, climate change must be addressed. We have to look at our fossil fuel use. We have to protect our vulnerable populations to deal with those HEAT wave, those issues that we talked about. How will each of these issues be addressed for the most vulnerable populations that do not have health care? We look at the policies, and we have to push for policies that protect you, decrease fossil fuel use, universal health care. How do we get access to food, access to water? Everything that we talked about for COVID applies for climate change. Climate change is hurting us now, it's hurting the most vulnerable among us, just like COVID is doing it acutely, but climate change will continue unless we make some changes. So by summarize the importance, and among your communities, wherever you are, there are clinician organizations. You can Google any of your clinician organizations for climate change. Every organization, your politicians, everyone has to step up, because this is the biggest of our social determinants, the planet that we live on. And unless we make those changes now, the death rates, what we're seeing for COVID, what will happen with climate change will make this look like a really blip in our overall history. So thank you.
Thank you, Dr. Holder. This is very important because we know that climate change was here and devastating our communities before COVID, and it's going to continue after COVID. And when we add COVID with the climate change, it becomes even more devastating for vulnerable populations. So thank you very much. Our next presenter is Dr. Mustafa Santiago Ali. He is the Vice President of Environmental Justice, Climate, and Community Revitalization for the National Wildlife Foundation, and also the founder of Revitalization Strategies, a business that focuses on moving our most vulnerable communities from surviving to thriving. Very important. Dr. Mustafa has worked for 24 years with the U.S. Environmental Protection Agency, and he began working on social justice even when he was a mere child, and has continued with that in his adulthood. He is a senior advisor for the Environmental Justice and Community Revitalization, an assistant associate administrator working to elevate environmental justice issues and strengthening the environmental justice policies, programs, and initiatives. Dr. Ali uses a holistic approach to revitalizing vulnerable communities. He is a renowned thought leader, international speaker, policymaker, community liaison, trainer, and facilitator. And we look forward to hearing Dr. Mustafa's comments about policy issues as it relates to environmental justice. Dr. Ali.
Thank you, Dr. Brown. And thank you to everyone who's participating on this call. Thank you for your service, and thank you for focusing on our most vulnerable communities. You know, it is a time now when people are actually placing a spotlight on our most vulnerable communities. And you know, when I talk about our most vulnerable communities in the context of environmental justice or environmental racism, we're talking about communities of color, we're talking about lower wealth communities, and we're talking about indigenous populations. And we know that these are the communities that have often been the sacrifice zones. These are the communities that have been the dumping grounds for everything that no one else wanted, along with the people who live in those communities. So we should just anchor it in that so that we're very clear about the work that needs to happen and the folks who have been impacted. I'm thankful to Dr. Holder also for, covering many of the issues that have been happening inside of our communities and continue to happen, and that are now finally starting to get a little bit of attention. I was raised in a family of Baptist and Pentecostal ministers, so I'm gonna do my best to be short and be brief. But we should anchor in the fact that 100,000 people are dying prematurely each year from air pollution. That's the conservative number. There's another study that's out there that says it may be as high as 200,000 people. That's more people who are dying from air pollution than are dying from gun violence. And all of us have seen how impactful that issue is and how important it is for us to get focused on it. It's also more people who are dying from that air pollution than are dying from car crashes and a number of other things. And these communities are dealing with the long-term chronic medical conditions that come from that exposure that Dr. Holder referenced when she was speaking. And we know that many, many different types of impacts are happening to folks' bodies from these exposures, from a number of various toxic chemicals. We know that we're dealing with cancer clusters. We know that we're dealing with liver and kidney disease. We know that we're dealing with heart disease, and we know that we're also dealing with various lung diseases, all that make these communities more vulnerable to being, infected and the loss of life from COVID-19. We also know that these communities, along with others, are dealing with asthma. 24 million people in our country have asthma, 7 million children. And we know that it is African Americans and Latinx folks who are the ones who are going to the emergency rooms and the ones who are losing their lives prematurely. It was referenced about coal-fired power plants. We know that 68% of African Americans live within 30 miles of those coal-fired power plants. And we also know that 1 million African Americans live near oil and gas facilities. Actually, 1 in 5 live within 1 mile of those, which are also exposing them to a number of impacts that, both on the state and the federal level, folks have to get focused and they have to tighten up these policies that are out there. And there will be need for new ones as, we're seeing that there are these additional impacts that are happening. These are communities that many of you probably have visited or have read about. Places like the Manchester community in Houston, Texas. We know in Houston, Texas, that we have, one of the hot spots that's developing. And, we have a lot of folks who are getting sick there. Well, in the Manchester community, when you go there, you literally, if you roll your windows down to your car, you feel like breathing in gasoline fumes. And these are some of the impacts that are happening there, along with the schools that are so closely located to many of these petrochemical facilities. If you go to Manchester community, you can literally stand in people's backyards and reach your hand out and touch the piping that exists, right outside of the property lines of many of these communities. So those exposures, that are coming out of those stacks, they're dealing with on a daily basis. If you just go a little bit further down the road to Port Arthur, Texas, a thriving at one time African-American community, has been, inundated with a number of different toxic facilities. And both the Manchester community and Port Arthur, Texas, which actually has Hilton Kelly, who lives there, was a Goldman Prize winner, actually had to also deal with Hurricane Harvey and the floods that were associated with that. And then the exposures that came from a number of other land-based types of exposures from Superfund sites and brownfield sites. So folks have also had to deal with that. Or you can go to the 48217, which is in Detroit, and we've seen the devastation that's happened in Detroit and the exposures that have been going on there. The 48217 is the most polluted zip code in the state of Michigan. So the children there who I've spent time with will often talk about how when they look out their windows, what they see are facilities instead of trees. So when you have that type of a situation going on, both on and I'm thankful that folks have been raising, the mental and stressors that go on, because these communities are under those on a constant basis, but also the impacts that are happening to their bodies. It's just unacceptable, and we have to do something about it. in our country, we also know that, over 60 million people over the last decade have been exposed to unhealthy drinking water. So, about 600,000 plus people every year. And we know that at the beginning of the coronavirus, one of the things that folks shared with us was the importance of water. And, one, being able to wash your hands, but two, making sure that you have something, that moves into your body that is a positive. And of course, we saw what happened in Flint, and we know there are over 3,000 locations across the country that have higher levels of lead in their water than Flint does. And everyone on this call knows the impacts that lead has on your body. Of course, it also weakens immune systems. And, that has to be our focus. Anytime any impacts are weakening immune systems, we know that it's going to make folks much more vulnerable. But we also have to be, focused on the fact that when we talk about washing your hands, we've got 500,000 homeless people in our country who don't have that opportunity. And the lack of testing that has happened in that space is something that has to change, along with the other communities that I mentioned just a moment ago. In my phone calls with environmental justice leaders across the country, only one of them shared the fact that there was testing that was happening in their respective area. Now, I have my own theories about why that lack of testing has been happening, and we can unpack that at the appropriate time. But I want to remind folks also, because I know you all are extremely focused on making sure that healthcare is accessible for everyone. The fact is, as we all know, and the presidential campaigns continue to sort of highlight it for us, that we've got 80 million people in our country who are uninsured and underinsured, and these communities have a significant amount of folks who are dealing with that particular issue. And then the other overlying thing is the wealth disparities that exist in our country. So in the environmental justice paradigm, we're very focused on housing and transportation, on wealth disparities and job creation, along with the impacts that are happening from environmental pollution. And of course, all of it ties back into climate change, because I hope that you all will remember that for a number of years, folks did not want to pay attention to the environmental justice impacts that were happening in these communities. And as we began to pay more attention to climate change, people were forced to begin to focus a bit more. And the reason being is that when you look at where primarily fossil fuel facilities are located, they're located in Black and brown communities on indigenous land and in lower white income areas. When you look at the infrastructure, the fossil fuel infrastructure, those pipelines, these are the communities that they run through along with farmland. We've got 2.4 million miles of that pipeline that's carrying those fossil fuels that, of course, are contributing to the public health impacts we've been talking about, but also are playing a role, as Dr. Holder shared, in the warming up of our oceans and our planet. So all of these things come together in the communities that are dealing with environmental injustices. And the way that we begin to address it, one, of course, is the continued education of the general population and continued building of capacity inside of our most vulnerable communities. And also on the state and the federal level, making sure that the legislation that's being moved, that there's an environmental justice or an equity analysis that is a part of all of our major pieces of legislation, to make sure that we are not contributing to additional impacts, but that we're also helping our most vulnerable communities to move from surviving to thriving. With that being said, I'm going to stop there and give back the remaining amount of my time.
Thank you, Dr. Ali. That's very important, because we know, just as your slide said, the power of our culture, collaborations, and communities is what's going to help us to move from surviving to thriving. I want to say to all of our listeners, please put your questions in our question box, because now we're going to open up our program for questions. It is important for us to look at how do we take the next step in changing the paradigm that we're seeing now. And so it becomes important, as you've heard from the speakers that have talked about, we have to expand our educational programs, our housing. We have to provide nutritious foods. We have to protect our workers. and really expand the access of vulnerable populations to the health services that are needed, such as the Medicaid, the SNAP programs, and partner, most importantly, with trusted members of the community. And the National Medical Association is a trusted resource. So as we move forward, post-COVID, we need to look at how do we collect data so that we can know the true impact upon our population. And once we've collected that data, how are we going to communicate that back to our communities? So the message and the messengers are very important. And the National Medical Association stands ready to serve in that position. We need to do contact tracing. And again, while social distancing is very important for us, we know that it has a negative impact on our communities because of the lack of income coming in, makes them more vulnerable. And of course, this increases, as one of our presenter slides say, stress for us, and that emotional stress has an impact upon our immune system. So you get into a circular environment, and we need to then break that circle so that we can then improve the health outcomes for our people. Again, questions are ready. And if our presenters would like to add a question or make a comment, please do so now.
Hi, this is Dr. Holder. I want to commend NMA for doing all the efforts and works across the country. But I also have to bring up, since I do wear my pipeline hat, that we are barely 5% of the physician population. And we are also part of the vulnerable population. And especially that we take care of the highest risk folks who are doing poorly with COVID. Our exposure and dying from COVID are Black nurses, are Black physicians. Here in Florida, I've already known of several Black physicians who have recovered. However, in New York, I know several who have passed. I've seen it online, and that's just one of the areas that we have to look at in vulnerability, is how protected are our physicians, and especially physicians in small practices. And will we remain viable to continue our work because of all the economic pressures, just not only our health, but if we do survive this, will we also survive economically? So the disparities are tremendous, not only for our patients, but also for the physicians. And I hope we can work together and find some solutions for that, especially as just accepting and making sure more Black physicians are in medical schools and as we go forward.
So now we will go through some questions, Dr. Brown. And while Dr. Brown is pulling up some questions, I have a question for Dr. Georges. You stated that 1/3 of seniors are not getting their prescriptions. Can you speak to that in terms of what effect that may have and what can be done about that?
Yes, Dr. Brooks. Here's the issue. The issue is the increasing costs of the prescription drugs. Now, even if you have Medicaid, you know, in many states, the number of times you can repeat a prescription or the number of pills you're allowed per month is a reality. But the problem is for those persons who do not, or even those who have prescription plans, one of the things has been the increasing out-of-pocket costs, particularly for those medications that, you know, that they need every day. And what we found in AARP is so many of our members have been telling us that they're now deciding, well, should I, for instance, Dr. Brooks said I have to take this medication every day. Now, should I make a decision, maybe if I break it in half? And as a nurse, I'm here to tell you, patients break their pills in half, you know, so that it could last them for the month. because they don't have enough dollars. We know that, and I'm not here to beat up on anybody today, but we do know that it is the cost of the prescription drugs that are crippling our members. We got 38 million members, and that's the people who are telling us what is going on. And that's where our data comes from, not just our members, but the general surveys that we have been doing. And we have been before Congress. Been at Ways and Means. I've been to the Oversight Monitoring Committee, giving them the data that we have collected over time and how this has placed such a burden on our members.
Thank you.
Thank you. Are there other questions? I do not see anything in the box, Vinay, so maybe they're coming to you.
Okay, well, while you find those questions, I have a question for Bob Blancato. You spoke to, and I think this is kind of important, you spoke to the compassionate side of the nation. We're hearing just a lot of, I won't say negativity, but just a lot of dire information. So could you just briefly state, and this is a little off subject, but just give me an example of something you felt that has shown compassion, because we need something uplifting at this point in the pandemic.
Thank you, Dr. Brooks. I guess the examples that I come upon the most are in the space of working with folks doing work in nutrition. So now, for example, when volunteers who are normally older are unable to go out and do their normal delivery of meals and services, now we find college students volunteering to take their place and go into communities and go into the homes and make sure that these older people, these vulnerable people get their meals. You know, the people who are doing these telephone reassurance calls, ARP happens to have a wonderful service like Community Connections that they're doing, where people are calling isolated folks to talk to them, to give them a means of communication. And I think that, every day, has been pointed out by the speakers, people who are quote unquote doing their job at a tremendous risk, I think they have to be evaluated in a different way. They are showing a higher level of compassion beyond doing their work because of the issue of risk and other things. So I think our nation, there are bad stories and there are dire stories, but there's stuff going on in the communities, in the streets every day, where people are stepping up and recognizing that we are in this together. We need to work through this together.
Thank you. Okay, Dr. Holder, a question for you. You mentioned that heart and lung conditions are worsened in heat. I think that's an important basic concept, because sometimes we need a link between climate change, and when we speak of climate change, generally we're speaking of the planet warming. And you also spoke to 2 degrees as being a significant change, because you're right. If I have a patient who is, let's say baseline is 99, which is still a normal temp, 2 degrees 101 is a real fever, okay? So what you're implying is 2 degrees higher on the planet is fever. Fever is an abnormal condition. So I really like that analogy. But going back to heat and heart and lung disease worsened by heat, could you expound on that just a bit, please?
Yeah, we see in the data the physiologic changes that the body goes through with heat, and just increasing your heart rate. We find that if you're having coronary artery disease, some of these extra stressors can then trigger that rupture of that clot and then trigger the heart attack. So they'll see the increase in heart attacks around these extreme weather events, especially with heat. In COPD, the internal temperatures, that's also been shown that will exacerbate and trigger a worsening of a COPD patient. So many times during the heat crisis, if you've been in New York and Paris and many of these cities that go through the heat crisis during the summers, many times it's the worsening, the exacerbation of a COPD. The changes in the pressures then trigger the worsening of the vasoconstriction and the bronchoconstriction, and the areas. So there's some physiologic changes that happen with the temperature rise. Dehydration is another area, and we'll see increase. We said heart and lung, but also kidneys, which is another big area, especially in folks who are migrant workers or farm workers. We're seeing a rise in acute kidney injury and kidney failure because the dehydration that happens because they don't get water breaks and the extreme heat and the longer time that it's hotter. So we're seeing kidney damage, we're seeing lung injury, we're seeing heart disease. Also heart failure, again with the fluid imbalance and the more work during heat. And you have to also keep your body temperature cooler. So the amount of work to cause the sweating and the cooling then also increases your metabolic load and increase your risk of failure. So the physiologic changes are there that just comes from the extreme heat.
Thank you.
Thank you. There is a second question for Drs. Ali and Dr. Holder. What is the role of clean energy and pollution reduction in improving the health in Black and Brown communities?
Dr. Ali, you're going to take that one? Okay.
Make sure you're off mute, Mustafa.
Yeah.
Okay, I'm finally off. I hit it like 5 times. No, it's critical. It is what everyone is working toward. As we move toward wind and solar, thermal, and tidal energy, along with new energy sources, clean energy sources that will be developed, is critical in us lowering the, the impacts that are happening from the carbon that we've been putting and the methane that's going into the atmosphere. So it is a part of a just transition paradigm as well. Making sure that as folks are transitioning out of dirty fossil fuels, that we're helping them to move into this new clean energy space. And it is also a part of the energy democracy paradigm, where our communities begin to actually own our energy sources, which is going to be critical as well.
Do you want to add something, Dr. Holder?
Yeah, for folks of color, clean energy is crucial because so much of the damage, the long-term damage to heat, but the short-term and acute is the pollution. And if you look at, even right now with the COVID-19, the regions with the high levels of air pollution, those are the same areas that we're seeing the folks dying from COVID. So anything that reduces our emission is going to improve our asthma, it's going to improve our heart disease, it's going to improve our lung disease, and especially for children, because when you think of particulate matter, gravity works, it drops it low. So who's lowest to the ground but children? So if we can do anything to decrease our children exposure to these emissions, we've done a huge benefit in decreasing asthma and long-term disease. I'm not surprised that so many of the Black folks dying from COVID aren't that old because they've been exposed to all this pollution from very early. So the lungs are not the same as somebody who had less emission exposure from childhood. So anything we can do to decrease the emission and air pollution is crucial for our communities. And so electric vehicles, decreasing fossil fuel use, adoption of all these electric passenger vehicles, anything we can do will definitely help. And also, if you look at as we transition to clean energy, there's opportunity in developing new skills that workers can hopefully increase their employment. And you're looking at the clean energy sector, they've created more jobs than the oil industry does. And it creates jobs to the level of workers that many of our Black and Brown people can easily participate in. So that's our goal we've got to reduce energy and we've got to improve clean energy and energy efficiency. Also, besides just clean energy, we got to look at energy efficiency. Just what do we do with our homes? How do we retrofit our homes? How much insulation we use? Gas stoves emit so much pollution in homes. How do we switch out of these gas stoves? As much as they cook lovely, but they do emit a lot of pollution for indoor pollution. So there are lots of things we can do to decrease our exposure to pollution, which will improve our health.
Thank you. We have another question here, and this is to Bob Blancato. Too many Black and Brown communities suffer from a lack of access to high quality food, which makes acquiring adequate nutrition a challenge. What solutions do you recommend for improving high quality food access?
That's a very good question, and it's one that we do need to get ourselves around. I think one of the issues is actually, in some ways, it parallels the prescription drug issue. It's a cost factor issue. You know, as long as non-nutritious food is easier to get and cheaper to buy than good quality food, we're going to have this problem. And there needs to be a whole reevaluation of pricing structures, of what is available to people. There should be as much available through, the good food supplies as, the lack of nutritious stuff that a lot of people are getting now. This is what makes this particular crisis right now involving our farmers and their inability to move their important crops like fruits and vegetables into areas where they're needed. This is indicative of a fact that we've not focused enough attention on getting proper nutritious foods to people, and it's something that we're all trying to work on a bit more. I think this situation with the Department of Agriculture now may shine a special new light on this that may push the process more, but I think we need to really focus on the very aspect of access and cost of good food and making it as available as not so nutritious food.
Thank you. And I have a general question for all of our panelists, and it centers around data collection. While it took some time for us to get the demographic data from the CDC and other organizations, how do you see the involvement for organizations such as the National Medical Association, our public health organizations, participating in gathering data collection and making it available to the communities that need it the most so that we can bring about effective change?
Well, I'll speak first. Somebody else? Yeah, this is Dr. Holder. I mean, data is key, and this is where science, if people were in charge, that were really much more of the scientists, they understand how important data is. Because anecdotal information, oh yeah, my neighbor did well because he took garlic or they did this, is what pushes the myths. Unless we collect really good data on overall larger numbers of folks, we're not going to get the answer. And when you see something happening, nothing is wrong in saying, why is it Black folks? And if you don't know why, how are you going to make the solution? And many folks are afraid of collecting race data, thinking there's some sort of unfairness to it, when what we're seeing is what is happening is real and we need the data. Like we see more men dying from COVID than women. If we didn't collect gender data, how would we realize that there may be something different that's happening to men that's making them more susceptible to COVID than women? And that's a lot of other issues, the same thing with Blacks. So it's so important that we find out who's not just race, but what is their job? What are some of the issues that's making this population get it so we can trace and contain? So the data is not to stigmatize, it is to be able to trace and track and contain. And so when folks understand why data is being used and why race becomes important, why gender becomes important, why socioeconomics and jobs, all this elements become important, because then we can track and contain. And in a respiratory infection like this that is so easy to spread, if we're not on our game by timely correct information, we're not going to be able to contain and decrease the spread. So the robust data is crucial, critical in any sort of infection process or any disease process in anything that we do.
Thank you. Any other panelists like to comment?
Yes, this is Alicia Georges. I think your question, Dr. Brown, it has a lot of implications. And I think we need to look for people that communities trust to share the data. But I think that also those trusted people must become critical partners in how the data is gathered and how the data are used. And as Dr. Holder said, we need the data to drive the science, and we need the science to drive the policies that will then make a difference in what happens. I can say to you that AARP is a repository of lots of data. Our things are done scientifically. If you go on our website, we've been speaking out about the issues around the disparities and the chronicity and the relationship between the two. And so I think communities, at least African American communities, must begin to trust, not, to trust us, not just AARP, but trust the people who do have the data and willing to share them, because we want to change behavior, as Dr. Holder was saying. We got to change the behavior of the communities so that we can live a healthier life.
Thank you so much. Those comments are all very valid, and we certainly want to thank our panelists. I want to just make one comment in terms of individuals that are trying to get a question in. It seems that we're having some technical problem with the questions, so that if you would transmit them either via an email address, if you see that in the information, or through the system, we will try to answer those questions and send a response back, but make sure you leave a contact information. I want to just acknowledge our sponsors, of course, the support from AARP, the Climate Action Campaign, and Abbott. And I'm going to allow Dr. Oliver Brooks, the president of NMA, to have closing remarks.
All right, well, thank you very much, Dr. Brown, for being an excellent moderator. And thank you to our 4 panelists, Dr. Catherine Alicia Georges, Mr. Bob Blancato, Dr. Cheryl Holder, and Mr. Mustafa Ali. Truly experts in their field, and it was clearly demonstrated by their presentation and their responses to questions. One of the things the NMA has been doing is trying to connect the dots. There's a lot of information out there, and it was spoken to that data has been a challenge. Data is king. So what we can do at the NMA is try to connect the dots. For example, today it was stated that with climate change, with the heat temperature increasing on the planet, we're at increased risk of heart, lung, and kidney disease. We're already at increased risk of heart, lung, and kidney disease. COVID-19 is killing African Americans at a rate 2.5 times more than the majority population. So you link that to the warming of the planet and climate change. It stated that our bodies are being damaged by climate change in areas such as just poor nutrition in terms of not able to have the access, and other areas as it relates to the damage from living within 30 miles of a power plant. That was very interesting information. So our bodies are beat down, and then you bring a pandemic such as a respiratory condition in, and that policy is relevant and it directs action in these areas. Instead, there are more jobs in clean energy versus oil, gas, and coal, dirty energy. So policy is very relevant. So the NMA does advocate for policies that are relevant to the African American community and physicians. For example, there's a House Bill 65 85, presented by Representative Bass, Karen Bass, and Barbara Lee, and supported by Senator Kamala Harris, to gather more data, to have a disparities panel to direct PPE to the appropriate areas, including those at disadvantage. So we support legislation such as that. So again, I really want to thank everyone for attending this and our presenters. As we move through what I refer to as phase 2, which is the war, phase 1 was the planning, phase 2 is the war, and phase 3 will be the post-mortem or the aftermath. I want all to be aware that NMA will be there out front, ensuring that our issues do not be part of a forgotten news cycle. I am concerned that it may look up a year from now and people can't spell the word disparity. We need to keep the focus on health equity and inequity. We are partnered with Rainbow Push, for example, in providing a manifesto found on our website, addressing issues such as testing, data collecting, protection for vulnerable populations, affirmative action, and aid to African countries related to COVID-19. We stand together as one, guarding the health and well-being of our doctors and our community. I will remind everyone to follow the COVID-19 prevention guidelines. Wash your hands often, cover your cough, mask when outdoors, physical distance, don't social distance. You can talk to anyone and be social as much as you want. Physical distance of 6 feet or more, wipe down surfaces as indicated, and seek care if sick. The symptoms are changing now. We all know of cough, shortness of breath, flu-like symptoms like pain or weakness. But now we're also noting headache, sore throat, GI symptoms. So if you're concerned, contact your doctor. You may not have to go in. There are telehealth visits. And so as I close, and as we think about the disparities as related to climate change, we've looked at HIV, we've looked at vaping, use of tobacco, we have to understand that disasters do not create disparities, they unmask them. So it is our job to work to reduce the disparities, to reduce health inequity, to keep our population safe and healthy. So with that, I say again, thank you to everyone involved, including Vinay Lobos, who manages the AV webinar aspect of this. And I now will say that the webinar has ended. Thank you very much.
It's